High blood pressure, or hypertension, is known as a silent killer because it typically has no warning signs or symptoms. Hypertension happens when the blood pressure in your arteries rises and your heart has to work much harder than normal to pump blood through the blood vessels. Healthing spoke with cardiologist Dr. Diego Delgado of Toronto's University Health Network, who is also a professor of medicine at the University of Toronto. He has treated heart patients for 25 years. Dr. Delgado, it's a medical condition that affects the body's arteries. Basically, the walls of the arteries are stiff, so the heart has to pump harder. That also creates cardiovascular problems, which is why hypertension is the #1 risk factor for stroke and a major risk factor for other cardiovascular diseases. Dr. D. Most people with hypertension do not have symptoms, even if the blood pressure reaches a dangerously high level. So that's one of the problems. And you can have hypertension for many, many years without any symptoms. So it is essential to be seen by a family doctor or a nurse who can measure the blood pressure regularly with the blood pressure cuff machine. Dr. D. Definitely there are risk factors: obesity or being overweight, family history of hypertension related to a genetic condition, not being physically active, smoking, diabetes, heavy alcohol intake and, of course, age. With age, the arteries get stiff and hypertension is more common. Then you have some chronic medical conditions like sleep apnea or kidney disease that can also trigger hypertension. Dr. D. We always recommend healthy lifestyle habits, and that includes, of course, cessation of smoking, regular physical exercise, eating well, maintaining a healthy weight or losing weight, reduced alcohol intake as well. Another one that is easy to say, but hard to for some patient is to have 7 to 9 hours of sleep. Dr. D. In some patients, even if they've followed these lifestyle recommendations, the hypertension can still be there and they need specific medications called hypertensive medications to help relax blood vessels. They can be used in isolation or in combination, and the choice of medication depends on multiple factors, including age, gender, race and any underlying medical conditions the patient may have. Dr. D. We need to be aware that this is a chronic disease that we call a silent killer, so checking the blood pressure regularly is essential. As with any chronic condition, if we don't detect it and treat it early, it has devastating cardiovascular consequences in the long term. If you enjoyed this video, share, like, and subscribe to our channel. For more information and resources to manage your healthcare journey, visit healthing.ca.